Rachel. I am never going to forget you now, Rachel. This is excellent. So I've already washed my hands, cleaned my stethoscope, and I'm here to demonstrate for the UDM students in the PA program how to do a cardiac and vascular exam. So great, thank you for volunteering. So I would have noticed just walking in the room any obvious anxiety or distress, any diaphoresis, any obvious JVD. I'd notice if you had the Levine sign, and I'd also be looking at your skin for any obvious venous distension. I think I already said that. I'm going to take your vitals. Can we wave me for vitals? Thank you. And they're done, but you all have to do the vitals. Thank you. And then I'm going to go forward, and we're going to do, I'm going to take a listen in, to your heart. So do you mind opening up your gown just so it comes out to about here? That's perfect. Very much. And then I'm going to inspect first, using my tangential lighting, for the PMI, and I'm also going to note any obvious lifts or heaves. And then I'm going to go ahead and I'm going to just use the side of my hand here and noting any palpable thrills in the right sternal border, the left sternal border, the base. And could you lift up your breast just for a minute? And the apex. Good. And I'm also going to check the PMI. Can you lean just forward for a second here? Checking the PMI. And then I'm also going to just kind of palpate your PMI here and your carotid artery and note that they're symmetric. I'm going to listen to your heart, and I'm going to ask you the whole time, if you could, to just lean forward while I listen, and I'm going to ask my students to say what space they're in. And so we're going to start in second interspace, patient's right aortic. Second interspace, left pulmonic. Third interspace, left second pulmonic. Fourth interspace, left tricuspid. I'm going to ask you to displace the breast upward again, if you could. And fifth intercostal space, mid-clavicular line, and lean forward. Mitral, and just stay right there for a second. Sorry about that. Okay. Perfect. Alrighty. And I'm going to repeat with my bell. Just a little bit more, thank you. Good. Very good. And then we're going to move on, and I'm going to have you lie back here a little bit. Lay that right there, okay? Okay. And we're going to go ahead and examine your neck vessels a little bit here. Put you at about 45 degrees, although I got a feeling we're not going to see too much in the way of neck vessels in a healthy person like you. And I'm going to just obviously look at the carotid artery and looking at the pulsations of the carotid artery. And then I'm also going to auscultate. I'm just going to start with the carotids above and below the bifurcation on each side. And then I'm also going to auscultate for venous hum and I would note that it was continuous, louder and diastole, and it would disappear if the jugular vein were occluded. And then I'm going to go ahead and palpate. I'm going to push on your arteries here, and I'm going to just carotid also, I'm going to go ahead and measure for JVD. I'm going to pantomime this measurement, okay? And what I would do is I would take a look here and I would identify where I see the internal jugular vein, the highest that goes. And then I would take a straight edge, and I would take my ruler, and I would take and identify that with the straight edge across so that it's parallel, and note off of the sternum where the highest point is, and note that that should not exceed the 3 or 4 centimeters. Right?
You only have to do that on one side?
I do that on the one side, yes. And then I'm going to go ahead and lie you back down. So could you sit up for a minute? And come back down. There you go. Thank you. And then we're going to do this again, okay? So I'm going to go ahead and inspect for any lifts or heaves. I'm going to palpate for the thrills. Could you displace your breast open? And I'm also going to go ahead and auscultate. I'm going to listen to your lungs in this position. Oh, I'm sorry. I got to do the PMI here. And now I'm going to go ahead and listen. Okay? My students, I ask them to say these positions all over again. So, right intercostal spacing, left intercostal space. Hold on. Which one is it? Thank you. Actually, it was second one.
Oh, second from out.
Fourth interspace. Tricuspid.
Tricuspid.
Fifth intercostal space at mid-clavicular line, or just inside his mitral. I'm going to flip it on over. I usually start back up at the top in this position.
How many times do you want us to say it every time we go over it?
You know, I like to know that you know your spots, so at least try to stay at the first way through the whole time. Then it's really nice to just listen, okay? And we're also going to want to turn you on your side. And I'm going to go ahead and listen to your mitral valve. I'm going to ask you to roll over on your side. Thank you. And I'm going to listen in the left lateral decubitus position. Both my thumb and my diaphragm. Perfect. And then we got to do some other stuff. I'm going to take some pulses, okay? Right. And can you just slip your shoes? Yep. Thanks. We're almost done. We're close. You probably aren't in the 15-minute time frame right now. Can I take your socks off? Oh, it's beautiful. Okay.
It says 20 minutes on here. Do we need to-
Oh, is it 20? Oh, right, lay that down there. Yeah, I was thinking respiratory. Darn it. Okay, so we're going to go ahead and I'm going to go ahead and just kind of take your pulses here. And it's okay to do them bilaterally. And I'm noting the rate, the contour, and the amplitude. Radial and the brachial. Great pulses. And then I'm also going to do the, we have some, we're going to kind of fake it here with this one, okay? So when we do the femoral pulse, the way we're going to do it is we're going to pretend that this is our patient model that has the shorts on, okay? So I'm going to go right over these shorts since this is probably going to end up filmed. And I'm going to go ahead and first auscultate the femoral pulse. And an easy way to find it is to flex the knee, and you can find the inguinal crease just by flexing the knee. And then you can go ahead and put her back down, flex the knee in the hip. And I'm going to auscultate, noting any obvious breweries, won't hear much. And then I'm going to palpate the femoral. Good femoral, strong femoral pulse. Then we're going to do it on the other side. You go ahead and flex your knee a little bit. Find that inguinal crease. Go ahead. That's good. through and get the popliteal, and again, it would be without, obviously without the, in fact, do you mind if I scoot you? I'm gonna just bend the knee a little bit and just relax and get way into that popliteal area. And palpate the pulse bilaterally. And the tibialis posterior area. And then the dorsalis pedis. I'm also gonna note the obvious, the capillary refill. And in your case, you have some nice fingernail polish on, so I'm just gonna do the tip of the finger and note that it comes back within about 2 seconds' time. I'll do that bilaterally. And then we'll go down to the toes. We have some toenail polish on, so again, the tip of the toe. And note the capillary refill. If there was no nail polish, we do it right on top of the nail. There we go. And then we're also gonna go ahead and look at the skin. And I would note the skin, looking at the texture of the skin, the temperature of the skin, and then, would you mind sitting up for a second? And I'm gonna have you go ahead and drape your legs over the table. And sometimes we'd even ask the patient just to stand up. And look, we're gonna look at the veins. In fact, let's have you go ahead and do that. Take this off, okay? And with the lower extremity, noting any obvious varicose veins. And can you turn away from me? Perfect. And what did I forget?
Muscular atrophy.
And any obvious muscular atrophy. And I think that's it.
Oh, that's it? Oh, okay.
I think so. Thank you so much. You were great.